Well, what makes a bone go out of place is a muscle, and what controls that muscle is a nerve, and what controls that nerve is the brain. What I do for a chiropractor is to help them get that muscle to behave precisely in an optimized way. And that's what neuromuscular calibration does the best. I want to invite you to our in-person live training. A unique aspect to this training is you're going to bring your patients to this training, and you're going to work on your own patients in the training. And what you're going to find is how to turn their diaphragm back on so that it stays on. And it will stay on, I guarantee that. And in the training, we're going to spend a very minimal amount of time on the lecture portion, and we're going to spend a lot of time on practice. You're going to practice 10 different breathing techniques that you'll be certified in. In addition to that, 5 other ancillary techniques that you're going to learn and be certified in this training so that you can enable your patients to breathe well, sleep well, and to lower their stress by 75%. When you come to take this class, you will be certified in how to diagnose the diaphragm function, how to turn that back on and show the patient that it has nothing to do with a skill. It's a reflexive action of the central nervous system. You will be certified on 5 other breathing techniques related to better breathing. And the best breathing is called simultaneous breathing. And that's where the chest and diaphragm cooperate perfectly together. And also nose breathing. How do you accomplish nose breathing? A lot of people breathe through their mouth, especially at night. And I'll show you a test on how you can rule that in and rule that out. So you'll be certified to enhance your patient's breathing on multiple levels and to have tests that tell you and the patient exactly the nature of the respiratory system. And what this relates to is stress and pain. Many of the pains, the top pains that people have, and I'll just give away a secret right here and now. If your patient has neck pain, low back pain, neck and shoulder pain rather, low back pain, and or tension and pain in the jaw, number 1, they have chronic stress. Chronic stress cycle. I will show you what this chronic stress cycle is and how it affects the entire body and brain. You'll learn how to do that. Also, when the chronic stress cycle has been going on for long enough, the chronic stress cycle behaves much like central sensitization. And so an intervention is necessary in order to get the body's healing mechanisms back online. And the side effect to all this is incredibly better sleep. Most people do not sleep well. The CDC knows that 40% of the population has a sleep issue of some kind. I believe that is wildly underestimated. Most of the people, just ask 10 people that you know. Ask 10 patients that you know. How well do they sleep? And this is the key thing. When they wake up in the morning, they will feel one of 4 things. Exhausted when they wake up, fatigued when they wake up, recovered when they wake up, or refreshed. Those 4 things give you the insight to their breathing while they're sleeping. Because the story of I went to sleep at this time and I woke up at that time doesn't mean anything. What counts is sleep result. And you can't sleep well unless you breathe well, period. You are the cornerstone of holistic care in the United States today. As such, you must know how to determine if your patient is breathing through their diaphragm or not, and their belly moving forward and backward has nothing to do with that. If you don't know this, you need to come to my training so that you can help your patients sleep well and have less stress. Here's what I want you to do now. If you're a chiropractor who really wants the cutting edge of the next thing in health and promoting health with your patients, this is it. I want you to go to this website right here, click on the link and sign up. And you'll be certified in this method to make sure your clients breathe well, sleep well, and keep their adjustments much, much longer. Thank you.